So when I got a job as a clinical laboratory scientist, she was my boss.
Wait, what was that again?
She was my boss.
I was the boss.
Anyway, hey everyone, I'm Dr. Khan.
And I'm Dr. Sherry Kochendoerfer.
And we're both physicians here at Mosaic Theory MD. During the times being in, medicine and having to go through what our healthcare system's really like, it really started dawning on us that it's really not what we thought it was going to be, and we were starting to get disillusioned with the healthcare system. Is why we even started our practice, which is in a very different model of care called direct primary care, which we're going to talk about in a separate video, but we're much happier in the sense of being doctors and being able to actually do medical care and actually have it be beneficial for our patients, that they actually get the time and a relationship with us that doesn't cost them an arm and a leg.
Yeah, because when we went into this, it was really about being that idealistic doctor of what we had always wanted to be, of making a difference out there in our community, in our home, and helping people. So for us, it was very important to set up a practice and do something that puts good out there, but it also sees the person as a whole.
Exactly. So what's with the name, right? Mosaic Theory MD. So what is a mosaic, right? It's a painting made up of different small, beautiful in and of itself pieces that put together make up a one large picture in a painting, right? We started looking at things that way too, that people are that way, right?
Yeah.
You have to look at the whole person, that there's different parts to them, like, sure, health, physical health, mental, spiritual health, and then our specialty in and of itself.
Internal medicine, right? So that as internists that we're trained on all of the systems of the body. So we rotate with a specialist, nephrology for the kidneys, cardiologists for the heart, neurologists for the brain, GI doctors for your intestinal tract, even with psychiatry, that we rotate with them as well, pulmonologists, lung doctors, we can go on. But the whole idea is that an internist, that you're encompassing all of the parts of a person's physical health and body to assess them as a whole.
And we thought our theory of care was that if we started looking at patients holistically in that sense, that patients would benefit and our medical care would actually be a lot more beneficial. Hence, Mosaic Theory. And MD because, well, we're both MDs.
We're both doctors. Yeah, to see all of you, that you're not just diabetes or blood pressure or depression, anxiety, that you're you, and we are the doctors who see that.
Yep, that if I just look at one piece of it, I might miss how it's interconnecting with other issues that might be going on. So that's the point of the name, and that's why we came up with the name as well. Where to start, right? I guess we can start way back when we met.
Tell them about the beginning. I always love the beginning part. Listen to this.
She's trying to tell you guys that. So I met her when I was a clinical laboratory scientist out of college. I had done 4 years of bachelor.
What was the part about when I met you?
Can we get to it, please?
Oh.
So I had graduated college with a 4-year degree, a bachelor's degree in clinical laboratory science, and I was looking for a job. I didn't go to medical school right out of college, neither did she.
No.
But so when I got a job as a clinical laboratory scientist, she was my boss.
Wait, what was that again?
She was my boss.
I was the boss.
Anyway, so come to find out that she had always wanted to go to medical school too, but for both of us, for one reason or another, we didn't go right out of college. But we decided that with each other's help and each other's support, that we could make it through. So we decided to apply to medical school. Turns out that if you've been out of college for a certain amount of years, your prerequisite medical courses to get into medical school are expired and they're no longer valid. So both of us had to go back to school, and it took us 1.5 years working during the daytime and going to school at night to be able to get those prerequisites done.
Long days, but fun days.
Yeah, we had a lot of fun though. Then we finally got all of those done, got our MCATs done. That's the exam that you take to even apply to medical school, and got into medical school, spent 4 years doing that journey. And after that, well, taking the boards together, 3 different exams, it was definitely...
It was a long road.
It was a long road. Finally got residencies. I got mine in internal medicine in Danbury, Connecticut.
And I in internal medicine in York, Pennsylvania.
Did those respectively for 3 more years, and finally found ourselves coming back home to Northern Virginia. Northern Virginia is home to me. I was born and raised here.
It's basically home for me, that I've been here for probably like 7-8 years before medical school, and then back and forth during the time of medical school. So all in all, I've been here quite some time.
Yep, in any case, I hope that you've learned a little bit about us.
And everyone remember, I was her boss.
Oh my God, whatever. We're now equals though, so.
In reality, yeah.
No, I still learn a lot from her. That, you know,
as do I.
Yeah, it's a partnership, and that we always learn from one another, lean on each other, support one another, and that's how we look at our community as well, is why we started this venture together. We'll be making some more videos so you can get to know us a little bit more. Until then, stay positive and stay healthy.